Professional curiosity as a nurse is about capacity and communication, investigating more about what is the root cause, how can I get to the root cause, how can I support this individual throughout this journey of whatever condition they're going through.
For me, it'll be like getting to know, to understand the reason why you're doing something. You're not just doing something blindly. You want to understand what's the benefit of doing it. When you know the benefit of doing it, then you do it. You are confident.
Collaborating with others, learning from each other, finding ways to solve problems, troubleshooting solutions for others. You can achieve much more if you have curiosity of the mind.
I approach people when I do home visits. I actually ask them relevant questions that actually is meaningful to their life. It also means maybe we have to have the right discussion with other people to ensure that the client well-being is paramount within what we do.
I think it's really important not to take service users or patients information that they provide to us at face value. It's really important to find out what's really happening to them. It's basically working together with them to find solutions to their problems.
You're not sure about something and you go back and you investigate, you find out more.
And if you are not helped, you can do tactics, you can do safeguarding, and you can go higher, seek to help to the manager and multidisciplinary to share until the need of their patient is met.
Being able to give care based on knowledge and evidence that I could actually back myself up on.
It's about the communication that you have with the families and with other professionals, and just constantly trying to improve on that communication. So that could be through a piece of paperwork that we have, that could be through the meetings that we put in place. It's just constantly trying to improve that communication, because through communication you can learn loads of things, and that's not just verbal communication.
It's a process of escalation. I mean, that's what it is. Being able to involve all the different healthcare professions, but not also, some of them may not be healthcare professions, but all professional bodies that can be involved in a patient's care.
That instinct, gut feeling, you want to do something is not quite right, and you have that gut feelings and you want to find out more and see what you can do to help. That's what it means, to me anyway.
You read more and research on what you think is the best according to you.
Having worked in the NHS for quite a long time, it's always about continually improving ourselves and looking beyond, I guess, and having those conversations, building relationships, whether that be with our families, the children, with our staff as well, isn't it? And encouraging that kind of open culture to kind of challenge and to learn from everything.
Usually is when I'm looking at a staff member who can actually then see their potential, grow their potential, and I'm curiously looking at where their skills are, where they can develop, how they've developed in the past, and where they can go in the future.
We have this saying about nurse intuition. Sometimes you have that kind of that gut feeling something isn't right, and it's just about kind of feeding into that appropriately, maybe questioning the family or just kind of looking things at a bigger picture to understand why things are not working or why things are happening the way they are.
You have to find out what exactly is happening with the patient and how that could impact on the patient. So for me, professional curiosity means probing, chipping off gradually, putting everything out, mapping it out, and looking at the picture you've got and using that picture to deliver the care for the patient.
We have to start thinking outside the box and looking at whether there are things we can change within our practice, whether they could be safer for the patient, more efficient, also more cost effective. So we have to be looking at things we can maybe change and make suggestions to the care we provide.
Being curious in the care of my patient, it gives me the opportunity to find out more about them, to find out what they need. Without being curious, some of the patients, they will be in their home not knowing the right place to go, the right help for them. If we don't try to be curious, we can't get the right treatment for them.
You can't take things at face value most of the time. You have to follow your instincts and look beyond what whoever is sitting in front of you has in mind, and that way you can work with other professionals to give the best quality of care to the person that you're looking after.
we having the ability to probe. We have loads of patients who are not able to advocate for themselves. Probing into their care needs, providing them adequate information in order to ensure that suitable services are given to them, help to signpost them through other service delivery that's not within our scope of practice.
You know, every patient's not the same. Everyone's different. And the longer you get a bigger relationship with them, the more you get to understand that not everyone's the same and everyone has different needs.
Well, you're being curious, you're digging in and to find out more information than what your service users are giving you, to be able to dig a little bit further, just not to go in and be task orientated, and to be able to deliver high standards of care.